The hospice at home team from Sandwell, from the NHS, and they started to come in. They were absolutely marvellous. They were really good. Everything that we needed or wanted, or even didn't know what we wanted, but they suggested we had. We got a really good relationship with them all, and they were really honest with us, which is what Pete wanted.
Sadly, lost my mother-in-law in the early hours of Sunday just gone, and she died in hospital. And there were quite a few things that drew my interest. The first one being basically that my wife had been part of a partial end-of-life plan for her mother, and she expressed the desire that she shouldn't be taken into general hospital. She was taken to general hospital, and that's where she passed away. Now, my question to the care home was, if we have this piece of paper, why were my wife's wishes not followed? And their answer was that we thought she would come back to us. So they thought the infection was such that she would have to stay in hospital and she would be returned. Now, my argument was, if there's a piece of paper that says no, why did you do it? And it was really a clinical judgment that they made, because it was a nursing care home. But there was also a question a few days before she passed away that the hospital were attempting to force feed her an NG tube, so I understand. And when my wife heard of that, she just sobbed. Nobody had asked, do you want your mum force fed?
The NHS continuing care funding kicked in almost straight away. Had carers coming in, but they never seemed to time it right. You know, I'd have just got mum onto the commode and changed and cleaned up and back in bed, and they'd turn up and she'd be asleep, and I'd have to say, look, you know, don't get her up again now. I've only just got her back into bed and she's peaceful.
And I've had cancer since 2007, and I've had to find out everything right from myself at first. And then I went to a hospice, and from there they helped me. But it was a long battle, you know, because you felt lonely, no one to turn to, you know, because I got terminal cancer. And I thought, well, who can I turn to? And every time you seem to hit a brick wall with the services. Well, I wouldn't have known about the services, but now I try and help people that don't know, you know, because I think I used to get upset, you know, because if you don't know anything, and you think, wondering to yourself, what am I going to do? If I had never had such a good family, I don't know where I would have been today, you know, because they pushed things along and they found out, same as me. I've got a computer, so I could go on the computer. Not everybody's got a computer, you know, and the doctors don't tell you. They never gave me no information when I was in the hospital 5 weeks to begin with. And they never gave me no leaflet to say, go to this place or ring this place or anything like that. They never done any of that.
So you had to find all that information out for yourself?
Yes. Okay. You know, and I thought that was quite bad.
It's communication and having one person where you can you've got a telephone line, one person telephone line, you can phone that help, I need some help. How can you do this? What can we do about this? I want to do this. How do I do it? Just one telephone. As in Vi's case, because of her hard of hearing, we have got a special telephone that she can. But she can pick the phone up and she can dial, and if she's got a problem, she will talk to but it's finding the right person. Yeah. So she's got one number, just put into her phone, she can press that number. She knows that she's going to get help at the end of that telephone because she has no family.
And would you like more help day to day?
I would if Karen was doing it.
But you wouldn't like other people?
I don't want a lot of people in the house. She's been very good.
Yeah?
She's golden.
Good.
I can give you an example, as if my parents has a visit from somebody, they say he only could speak one language and they didn't have an interpreter, then they'll have to go out the way and get an interpreter to understand what their needs are. So if it was somebody like when you come into, say, with my parents, as a generation behind, they'll feel more comfortable with somebody that can speak the language, and they will feel that they're doing it through somebody rather than translating it, where they think, what if they're saying different things to somebody else?
So it was that was what you were saying earlier, that actually, you know, why can't we have more staff who actually speak
bilingual,
the language?
yeah.
Yeah.
Who are bilingual,
Yeah.
that can be using the both
Yeah.
sides rather than
just using interpreters.
Yeah.
Yeah. Okay. Cool.
So because the interpreters will be there, but sometimes the interpreters are not in the same field, so they can.
Strangely enough, there was a man on the wireless the other day on the radio talking about his mother's death and how he'd gone to the hospital and he knew she wasn't being cared for properly, that she was suffering from dehydration, and he was marvellous the way he explained it, because he said, I found it really difficult to separate my feelings of despair and unhappiness at my mother's death and my sense of injustice at what was happening, the lack of care. And he said, and I was so emotional, it was difficult to know what I was saying was right, and that's the problem really, you know, how can you separate your feelings of grief and loss about someone that's so dear to you away from the kind of care that you're receiving? It's really hard to... Well, it's difficult to know what could have been improved really, because everything was pretty much as good as it could possibly have been, but it was still terribly difficult. So...
He'd expressed to them that he wanted to go into a care home or a hospice at the end. As the reasons being, he didn't want me to see him die at home. He didn't want me to have memories of him dying at home. He was on what I later could only describe as a camp bed. It was so low to the floor. He was just propped up on 3 pillows. No, the bed didn't come up. He was just propped up, sort of lying there, really scrunched up on the 3 pillows. And obviously at this point he was really weak. The bed linen, it was washed out. Careworn, shall I say. It wasn't dirty, and I never said nothing matched. Big black mark all along the wall where obviously a bed had been. And the smell was just overwhelming, again, of urine. And Pete laying there, and I looked at him and I went, and he went, Karen, I can smell wee. And I went, yeah, and it was the carpet. It just smelled so badly. My one daughter, obviously the youngest one, was, you know, getting upset at this point. And I went, oh, Pete, I said, this is not what, you know. I'm here now, I'm here, just leave me. Okay. The sister came in. And it's just, I mean, I work myself with people and families, and you know what respect is, don't you? You know. And I was sitting on the chair, and she came in, and she stood next to me, and she stood above me, and looked down on me, and looked down on Pete. Mumbled what we could do and what we couldn't do. She sort of disappeared, and then one of the care workers came. So she went away and brought the tea back and plunked it. Then I noticed that there was no alarm. There was no alarm in the room if we needed anybody. So I asked about an alarm. You know, I'm thinking, you knew this patient was coming. You've known since this morning, and this room was really not prepared. They found me one and sort of dumped it on the table. And then she came back with a tea and put it on the little trolley that goes over his bed, and I, you know, he had a few sips. Well, by this time I was like, oh, and then she said, something about what his name was. And I said, he does answer. I said, I know he's got John above his bed. I said, but he does answer to Pete a little bit better. Oh, all right then, John, Jack, Jim, whatever your name is, all right then.